A concussion is a brain injury. People think of it as getting your bell rung or getting a ding, but the truth of the matter is that it's a brain injury. The biggest cause of concussion is getting hit to the head, but it can happen in all sorts of different ways. It can happen certainly on a sports field, a helmet-to-helmet collision, for example, but it can also happen in ways that you might not expect. For example, in a car accident, even if your head doesn't hit the dashboard or hit the windshield, just the violent moving back and forth of the brain within the skull during a car accident, for example, can cause a concussion. People think, for example, if this is the brain, around it is a skull, and then you have a helmet, that there's a blow and everything you just get a blow to the brain. That's not exactly what's happening. Typically, if all of a sudden this brain is moving this direction, another helmet, for example, is moving this direction, and then they both suddenly stop, what happens is this brain keeps moving within the skull, bounces back and forth, almost like a beach ball in a swimming pool. And at the same time that's happening, the brain is actually elongating. It's like almost a fluid medium. It feels like almost like jello, and it's going back and forth and stretching out at the same time. And that's really what ends up causing that concussion, that back and forth, that stretching out. One thing to keep in mind about concussions, they don't mean that you necessarily lost consciousness. People can have concussions and have been awake, a really important point. Typically, someone is just going to feel a little bit out of sorts. They may have a hard time figuring out exactly where they are, what their surroundings are. They may be seeing stars, especially in the outside of their vision, the periphery of their vision. Things may sound hollow because their hearing is not quite intact right after a concussion. But typically, it's people around somebody who's had a concussion that are going to notice the most. All people recover differently from concussions. Some people could take weeks to recover, some people may take just a few days, but the key is that they have to be absolutely symptom-free. They can't have any symptoms at all, because what that means is that the brain is not completely healed. And if the brain is not completely healed, and the person gets a second concussion, then all of a sudden you've taken a problem that someone could recover from and turned it into a potentially fatal problem. The brain needs to rest, and that means lots of things. No texting, for example, no screen time. Reading puts a strain on the brain. So you tell people to really completely do nothing, at least for several days, until all of their symptoms has gone away, and then you slowly resume activity.
We had two students who participated in our meeting in Washington in November, and both of them had played soccer and had suffered concussions. And they described in detail the difficulty they had in getting back on track, in being able to study, being able to sit in a room with lights, being able to take a test. So return to play is one thing, return to classroom is another.
And I'm going to come back to you in a second, because I want to talk about the reliability of diagnosis. You bring up a really interesting point, and we place a lot at the ground of sideline exams and being able to tell in sometimes a chaotic environment what's happening, but we'll come back to that. Kate, Carol, when you watch a video like that, and again, you get the same questions that I'm asking, and I ask because I get to moderate the panel today, so I don't have to answer the same question, but what do you think about when you hear should somebody playing sports with regard to concussions? How do you balance it for the people that you're helping out?
We don't know what goes on inside the brain. I mean, we can measure our heart rate, we can take our pulse, we know if we have a broken bone, but the force of that energy hitting your head, causing the brain to go back and forth, we haven't figured out how much damage is there, how do we diagnose it, how do we treat it. We know from already clinical observations that not everyone has the same, not every concussion has the same impact, that one individual could be very different from the same type of blow and have a very different need for a recovery strategy. And we're just beginning to understand what's underlying that, but there's a tremendous amount of research that has to happen. So given what we don't know, given the fact that it's a mystery what's happening inside the brain during this, I think what we have to say to parents and to kids, learn to identify what the symptoms are. For young athletes, don't be afraid to talk about the fact that you have symptoms, because there is a culture, and I've heard from many athletes, that they're just going to shrug it off because they're so excited about playing the game. They want to win. And this isn't something that simply happens in our professional leagues. Our young athletes are inspired by today's athletes. We have to teach an athlete that it's okay to say, I've been injured and it's a concussion, or I think I have a concussion. We have to learn at the sidelines how to evaluate that player to know whether we need to sit them out and for how long they need to be out, not only of play, but out of school, as you say. And then how do we look at the prevention angle? Because there are things that we can do to prevent that injury from happening. In some sports, and I want to applaud the Heads Up activities, the Heads Up campaign that is going on that says we are not going to have that head-on impact in our practices. We're going to teach our players that we're not starting in a three-point stance, so we're adapting and we're changing some of the games, and I think that is clearly reducing the number of concussions that are happening.